The one vitamin that can end poor circulation in your legs and feet. Is poor circulation silently sabotaging your health? From cold feet to serious conditions like heart disease and strokes, restricted blood flow can lead to life-threatening complications. But what if there's a simple way to improve it? Discover the causes, signs, and the number one vitamin that can help restore healthy circulation. Don't ignore the warning signs. Take control of your health before it's too late. Watch now to learn how you can boost circulation and protect your well-being. You won't want to miss this vital information. Poor circulation is a silent disruptor that can gradually sabotage your health, often without you realizing it. We tend to dismiss symptoms like cold hands and feet, tingling, or muscle cramps as minor inconveniences, but these are often warning signs of something more serious lurking beneath the surface. The reality is that poor blood flow, if left unaddressed, can contribute to a range of devastating health conditions, including heart disease, stroke, tissue damage, and even the loss of limbs. Your circulatory system is responsible for transporting blood, oxygen, and nutrients to every cell in your body. When this system is compromised, it affects every part of your body, especially the extremities where blood has to travel the furthest. Poor circulation may begin as something subtle, a slight tingling in the fingers or cold feet that you brush off, but over time, if not addressed, it can lead to severe complications like organ failure or even death. The most concerning part? It often goes unnoticed until it's too late. One of the primary causes of poor circulation is heart disease. The heart is the powerhouse of your circulatory system, pumping blood to all parts of the body. However, when the heart is compromised, whether by conditions such as heart failure, coronary artery disease, or arrhythmias, it becomes less effective at circulating blood. For example, in heart failure, the heart struggles to pump blood efficiently, which causes a ripple effect throughout the body. The organs and tissues don't receive the oxygen and nutrients they need to function properly. Over time, this leads to chronic fatigue, muscle cramps, swelling, particularly in the lower extremities, and in severe cases, organ failure. Similarly, coronary artery disease, caused by the buildup of plaque in the arteries, reduces the heart's ability to pump blood effectively. The arteries supplying the heart muscle become narrowed or blocked, which restricts the flow of blood to vital organs. This condition increases the risk of heart attacks and further exacerbates circulation problems throughout the body. Irregular heartbeats, or arrhythmias, also disrupt circulation. Even a slight irregularity in the heart's rhythm can cause inefficient blood flow, particularly to the brain and limbs. This can lead to dizziness, shortness of breath, and cold hands and feet. The heart's inability to maintain a steady rhythm means the body's circulation system is constantly thrown off balance, and the extremities are often the first to suffer. The health of your blood vessels plays a critical role in circulation as well. Healthy arteries and veins ensure smooth, unobstructed blood flow. But conditions such as atherosclerosis, a condition in which plaque builds up inside the arteries, can dramatically reduce blood flow, leading to poor circulation. This narrowing of the arteries means less oxygen and fewer nutrients can reach your vital organs and muscles. Over time, this can lead to heart disease, strokes, and peripheral artery disease, PAD, which specifically affects the arteries that supply blood to the legs and feet. When these arteries become narrowed, blood flow to the extremities is severely restricted. As a result, you may experience pain in the legs while walking, slow-healing wounds, and, in the worst cases, tissue death. Another major issue that contributes to poor circulation is the formation of blood clots. Blood clots can form in the arteries and veins, completely blocking blood flow and causing immediate tissue damage. When a clot forms in an artery, the blood flow to that specific area is blocked, leading to severe consequences like heart attacks or strokes. Clots that form in veins, such as those found in deep vein thrombosis, DVT, can lead to swelling, pain, and the possibility of life-threatening complications if the clot travels to the lungs, causing a pulmonary embolism. Even conditions like varicose veins, though often dismissed as merely cosmetic, can impede circulation in the legs, causing aching, swelling, and increasing the risk of clots. But the problems don't stop there. Your blood itself plays a major role in circulation. For instance, high cholesterol levels are a common cause of atherosclerosis, contributing to plaque buildup and artery narrowing. This not only limits blood flow but also raises the risk of heart attacks and strokes. On top of that, anemia, caused by low iron levels, can also affect circulation. Iron is crucial for the production of hemoglobin, a protein in red blood cells that carries oxygen throughout the body. Without enough iron, your body cannot produce sufficient healthy red blood cells, and as a result, your tissues and organs are starved for oxygen. This causes fatigue, weakness, and cold extremities, all common signs of poor circulation. Diabetes is another condition that severely impacts circulation. High blood sugar levels over time damage blood vessels, causing them to narrow and reducing blood flow, particularly in the legs and feet. For individuals with diabetes, poor circulation can lead to slow-healing wounds, infections, and, in severe cases, amputations. Properly managing blood sugar levels is critical in preventing vascular damage and improving circulation. High blood pressure, hypertension, and low blood pressure both have a dramatic effect on circulation. High blood pressure puts extra strain on the walls of blood vessels, leading to damage over time. This makes the arteries less flexible and more prone to blockages, which restricts blood flow. On the other hand, low blood pressure doesn't provide enough force to push blood through the arteries effectively, particularly to the extremities. This can result in symptoms like dizziness, lightheadedness, and cold hands and feet due to a lack of blood reaching these areas. Both high and low blood pressure need to be managed carefully to maintain optimal circulation. Recognizing the signs of poor circulation early on is critical to preventing serious health issues down the road. Symptoms often appear first in the extremities. Cold hands and feet, tingling, hair loss, and slow-healing wounds are some of the most common physical symptoms of poor circulation. These symptoms occur because the extremities are the furthest from the heart, and when blood flow is restricted, these areas are the first to suffer. Additionally, poor circulation can lead to brittle nails, erectile dysfunction, and even nerve damage. Slow-healing wounds are particularly concerning. When circulation is poor, your body struggles to deliver the immune cells and nutrients needed for healing. This can lead to infections, especially in individuals with conditions like diabetes. If left untreated, wounds can become infected and may require amputation in extreme cases. Peripheral arterial disease, PAD, and blood clots also present serious risks, including tissue death, infection, and the possibility of limb amputation. Given the serious consequences of poor circulation, it's essential to seek medical evaluation if you're experiencing any of these symptoms, even if they seem minor. Conditions like heart disease, diabetes, and PAD all require timely intervention to prevent long-term damage. Medical professionals may use tests like Doppler ultrasound or ankle brachial index, ABI, to diagnose circulation problems and recommend treatments that can improve your condition. Treatment options vary based on the severity of your symptoms and may include lifestyle changes, medications, or even surgical interventions for more serious cases. Maintaining optimal circulation is vital for overall health, and while lifestyle changes like exercise, a balanced diet, and proper blood pressure management are key, certain vitamins and supplements can support healthy circulation. Supplements like vitamin B3, niacin, curcumin, and omega-3 fatty acids are all proven to improve circulation by supporting vessel function, reducing inflammation, and promoting better oxygen and nutrient delivery throughout the body. Ultimately, understanding the signs and causes of poor circulation, and taking action early, is essential in protecting your health and preventing serious complications. By making informed decisions about diet, exercise, and supplementation, and by seeking medical help when needed, you can ensure that your circulation remains optimal and protect yourself from the long-term risks of restricted blood flow. Poor circulation is a silent yet powerful disruptor of your health, often leading to serious complications like heart disease, strokes, and limb loss. While symptoms like cold hands and feet may seem minor, they can be warning signs of underlying issues, such as heart conditions, blood vessel problems, or blood clots. It's essential to understand the causes, ranging from heart failure to diabetes, and to recognize the early symptoms to prevent long-term damage. By focusing on lifestyle changes, such as exercise, managing blood pressure, and incorporating circulation-boosting supplements, you can significantly improve your blood flow and overall health. The lesson here is clear: paying attention to the signs of poor circulation and acting early can make all the difference. Prioritize a healthy lifestyle, seek medical evaluation when necessary, and make small, daily changes to improve circulation, ensuring better health and well-being as you age. If you found this video helpful, don't forget to subscribe to our channel. Your support motivates us to keep bringing you valuable insights and tips for living a healthier, happier life. Join us as we continue to explore important health topics that can transform your well-being.